Hi everybody, welcome to the Human Function Back Pain and Sciatica Solution video. My name is Ian Johnsen. I'm a physical therapist and exercise science specialist out here in Seattle, and I'm really excited to share this video with you guys. I'm going to take a moment to let you know what a PT is, introduce myself a bit more, and if you are in a big hurry, just go ahead and skip forward through the video and get right into the exercises. But for those of you that are interested, just keep right on listening. So if you're still listening, once again, my name is Ian Johnsen. I'm a little more about me anyhow. I'm a husband and a father of two crazy little girls who are now 7 and 11 years old. Before that, I grew up in Seattle playing soccer, riding bikes, riding cross country, skateboards, anything active you can really think of, I probably did it. I've had plenty of injuries as a result of that. I've broken forearms, clavicles, fractured ankles, torn hip flexors, plenty of torn ligaments, crushed my pelvis playing soccer at one point. I've had thoracic outlet syndrome from too much computer use, whiplash a couple times, plantar fasciitis. The list continues, unfortunately. But that's good and bad, right? I mean, I've seen a lot and felt a lot, which helps me provide what I think is a better analytical base for treating injuries of all sorts. So, when I was about 14, I decided I would become a sports medicine doctor. I think because it sounded sexy and combined a couple of things that I was very interested in: sports and a great career and a respected position that pays well. I graduated high school with no money for college and decided it would be best for me to head for the military. I was fortunate enough to spend 4 years in Germany as a communications specialist and met some pretty amazing people along the way. When I took leave, or when I discharged, I took advantage of the Army College Fund and started on my path to becoming a sports med doctor. I'd always wanted to be that, so that's where I went. I started learning along the way, though, that it doesn't really turn out that a sports medicine doctor is doing what I thought it did. I thought it was going to be natural treatments and remedies to get people back healthy and quick onto the sporting field, but in reality it was becoming an actual physician or surgeon that would first try to correct issues with drugs or sending people to physical therapy, or in the worst case scenario, or sometimes best case scenario, performing a surgery. And it wasn't really what was speaking to me at that point in time. So I pivoted a little bit and decided I'd go through the route of learning more about exercise science. Got my bachelor's degree in exercise science. As I was going through that program, decided that I wanted more than just to be a personal trainer, so I took advantage of the skills I'd picked up and all the courses I had taken and moved towards becoming a physical therapist. Got accepted to a great school out in Denver and went through a master's program that eventually allowed me to get my certificate and start treating in Washington. So flash forward, I've been now a physical therapist in Seattle for 13 years. I've treated people from all over the United States, coast to coast. People like to ask me what my specialty is. I like to say physical therapy, but in particular it's orthopedic physical therapy, and I've had advanced training in lumbopelvic analysis and treatment. So that's the majority of what I treat in the clinic, but I'm also an expert in postural balancing, fitness development, and weight loss. I've made the decision in my clinic that injury reduction isn't good enough. It's good enough for insurance companies, but it's not good enough for me. Insurance wants you to get back to your prior level of function, meaning injury is gone, you're back to your normal daily life. But for instance, if I have somebody that comes into my clinic with a knee replacement, but the knee replacement happened because they were overweight, well, the insurance company doesn't want to take care of the overweight problem. They just want to now focus on this replaced knee, get that better, and then send the person out on their way, even though they've got one more knee that's probably going to suffer down the road. So as part of our total treatment package, we want to make sure that when your injury is gone, you can use this moment in time as a launching point to improve your overall health and wellness, which means to us that we're going to get you on, hopefully, some sort of a fitness program and also on a weight loss program, which for us means lower glycemic eating or glycemic index-based eating and glycemic load-based eating, which is a whole other conversation. But if we do this right, then you're in a better state of health and we're done. You know, you're on to a hopefully healthier lifestyle long term. So here we go. I'm giving you these videos because I know they work. I know these techniques have helped thousands of people that are suffering from lumbar and sciatic pain, and I'm really hoping that this is the solution for you guys. So on to the videos. Thanks. Okay, so we're transitioning here into some images. This images, as it comes down, you'll see that big yellow thing in the middle is your sciatic nerve. We're looking at the back of the right hip and thigh, and as we get higher, we're getting underneath the area where the glute muscle would lay across. And if you look closely, you can see how that nerve comes right out from in between a couple of muscles up there. One of the muscles is your piriformis muscle, and that's the main muscle that will cause sciatica. So the exercise videos we show you will be focused heavily on reducing the pressure to the nerve in that area. If we have a muscle in that area that's just simply too short or too tight, it's going to press right on the sciatic nerve, and that sciatic nerve carries it carries information that causes the sensation of burning, numbness, tingling, shooting pain, even achiness, things of that nature. And it will carry that message back up to your brain and give you that feeling of pain. So if we can simply reduce the amount of tension in that muscle and take the pressure off of the nerve will flesh back out. It'll become a little bit wider, and the pinched and compressed area will resolve over time. It doesn't take all that long if it's a pretty mild case. If you've had this for a long time, you can expect that the nerve is going to take a bit longer to recover, maybe a period of a few weeks. That being said, this isn't the only reason sciatica occurs. You can have sciatica if you have a bulging disc or if you have some kind of degeneration of the spine where the space where the nerve comes out at the spinal level has shrunk down. So if you have this kind of sciatica, this type of stretching will do a great job of relieving it. If you don't, we need to look at a few different things. You may need to have your pelvic alignment analyzed to make sure that everything is neutral and straight and that all the other muscles surrounding the pelvis are actually at their proper lengths so that you're not getting a compression of the nerve from one of those other causes. The following exercises are all pretty simple and safe. If they don't work, it's not a big deal. You're not going to hurt yourself doing these things. Just go light and easy and see what happens over time. If it looks like it's not working for you, then you're going to need to go ahead and consult your physician, go in and see a physical therapist, and see what else can be done. But it's definitely a treatable condition. All right, here come the videos. In this first video, we're looking at a piriformis stretch. You're going to take that right leg and place the foot right onto the left knee, grab a hold of the knee and pull it across the body towards the opposite shoulder. It's important to get pulled all the way across and then just hold there steadily. We're doing a really short interval here, but you're going to hold these for 30 seconds at a time on each side. Medium pressure, don't pull too hard, but definitely get the 3 times in. If you do 1 or 2, it's okay, but it's just not going to give you the length of the muscle that we're really looking for. So he's just going to repeat this a few times for us. And then here in this section, you'll see that we've placed the right hand down on the right ankle. That gave it a little bit more torque. So you will outgrow these exercises. And when you do, just go ahead and either pull a little bit harder or hold them a little bit longer to get a better stretch. The second stretch, we're stretching 2 knees to chest. We're pulling up 1 at a time if you're having active back pain. If you're not, just pull both up. Pull up nice and firm, just try to hold them in place. So now we're actually stretching more of your low back area, that section where the sciatic nerve could be coming out. If you've got some degeneration in the spine or a disc issue, you may get some relief with this one. Once again, 1 knee up, 2nd knee up, pull up and hold nice and steady. Those are going to be 30-second holds once again. Pretty simple. Our third stretch here is for the external rotation of the hip. And what we're doing is we're going to place that right foot again up onto the opposite knee. But now instead of pulling across towards your shoulder, you're pushing down and away from your body. Hold that also for about 30 seconds. Medium force, not too crazy with it. What we're stretching there is called the gemelli muscles of the hip. It's another one of the muscles that may be pushing down on that sciatic nerve. Some people can't get much out of this stretch. I would just give it a shot. If you get something out of it, use it. If it doesn't feel right, stop. So the next stretch here is actually a hamstring stretch. Most people think our hamstrings are a single muscle group, and the standard stretch that we've seen over the years has just been to sit on the floor and do like a hurdler stretch or something along that line where you lean forward like this and hang onto the foot. And you do get a pretty good stretch with that. You stretch both hamstring muscles at once, but we can get more specific with it. When you're doing the stretch, you are going to do the same thing. You're going to lean down and hold it for 30 seconds at a time, and repeat that 3 times, of course. After the 3rd time, what I want you to do is rotate your foot either to the inside or the outside, and you'll notice that you're hitting a different part of the hamstring muscle group when you do that, either that lateral or medial hamstring group. So it's important to do really 3 stretches when you do your hamstrings. You're going to stretch straight on forward, turn the foot into the middle, or turn it on to the outside, and hold and do the same thing. So 3 sets of 30 seconds. Turns out to be 9 stretches. It takes a little while, but it does a really good job of lengthening out not only the hamstring muscle, but the sciatic nerve at the same time. Many times the sciatic nerve will become shortened if it's been trapped under that piriformis for too long, so it's a very important stretch in your recovery. These next 2 activities are very important, very effective. We're looking at a foam rolling situation right here. So if you have access to a foam roller, or if you don't, go ahead and purchase one and give it a try. They have them at the gym typically as well. You can try the gym foam rollers. They're usually a little bit softer and a little beat up, but they can be effective as well. You can see that in the demonstration, we're rubbing right through the back of that glute area. You're going to know where to massage once you've done the stretches, and you can feel your areas of tightness. And that's really what you're doing. You're just rolling back and forth, not on any of the bones. You're staying off of the hip bone, you're staying off of the tailbone, right in the meat of the muscle, and just gliding back and forth on it. If you find a spot that is really tender or really sore, really tight, spend some time there, and then do a little rock to your right and to your left, and see if you can get that to release a bit. When we find the tight spots, it's good to just sit on them for a little while and let them release. You can see in the video that Elmer just put his knee, or his foot up on top of his knee, and that exposes a little bit more of that piriformis muscle, making it a much more intense massage. Give that a shot if the other one isn't doing anything. If it looks like this isn't going to be enough to really get into that muscle and release it, you're just not getting enough pressure on it, you're not feeling a good release, then you go on to this next exercise, which is with lacrosse ball. With lacrosse ball, you go ahead and set that up so that it's in that same meaty area on the back of the hip. Just find the mid-glute area to start with. Then you're going to go ahead and hop up on the table or on the floor. Place the ball under the back of the glute and apply some pressure. You can use that back arm and that leg that's bent to take some of the pressure off. This can be pretty intense, so be really careful with it. But you are going to find some tight spots and put some pressure on them. And again, just looking at trigger pointing that muscle, and that just means getting into the middle of the muscle belly and allowing it to open up and release. Very effective method of decreasing some of that tension and pain in the area. Okay, and that's pretty much it. That was all of the exercises I was planning to give you guys. This last video clip here is just another angle of the same exercise. You're just going to see Elmer get back up there and push through the muscle belly once again, doing trigger point releasing. So give this stuff all a try. I really do hope that this is the solution for the sciatica you're suffering, or from some of the back pain that may be occurring. If it doesn't work out, feel free to email us and we can come up with some other strategies. This is very effective, however, so I'm really rooting for you here. I'm going to finish this up, and you guys can just review this at your leisure, give it a try, and I'd love to get some feedback. You can always email me at ian@human-function.com, and I'd be happy to respond to any questions, comments, concerns. And if you need to come in and see me, please don't hesitate to call us either. Our number here is 206-734-9033. This picture here is me in San Diego, and here's a little clip for you. If you feel like quitting, think about why you started. So I just want to encourage you guys to really put in the effort to get these exercises done. Stick with them for a couple weeks, see if you get some relief, and hopefully that's the end for you guys. All right, take care.